So, hello, ladies and gentlemen. Welcome to the World Diabetes Day on 14th of every November. I'd like to welcome you to this session, and I'll be talking about some brief facts about diabetes. So, take your time and listen. My name is Isaac Ogutu, the founder for Fitness 20 Healthcare. Now, in 2021, a study conducted and reported by CDC, that is for Center for Disease Control, reported that in 2021 alone, there were 537 million people in the world in the age of 20 to 79 years living with the diabetes. And the number is projected to reach at least 643 million by the year 2030. And you also see that about 6.7 million deaths were reported whose are etiologies of diabetes in the year 2021. So we are seeing basing on those demos and basing on those statistics that diabetes is actually becoming one of the threat or the killer diseases as speculated by WHO and CDC. So welcome to this brief session, and we'll be discussing about the numbers of issues to do or to concern diabetes. So welcome so much once again. My name is Isaac Ogutu. Now, I will start my session by asking you a simple question. What is diabetes? And if you know what is diabetes, how many types of diabetes do you know? Ama you just know diabetes kama ugonjwa wa sukari and that's all. So I'll take you through a number of issues, and one will be dealing with the type of diabetes, and another one will be doing at after the types of the diabetes, we'll be looking at the risk population. That's the specific type of people, the specific group of people that are very much susceptible or likely to get the diabetes. And we'll be also talking about the signs and symptoms that are associated with diabetes, and we'll look at the complication management and the treatment of diabetes. So I'll start with the types, and before I get to the types of diabetes, let me do a brief overview of what diabetes is. Diabetes, in a brief explanation or a description, is that when your body or the glucose, I say the blood sugar level of your body increase beyond the normal, that is called diabetes. And remember, your body is made or is created by God in such a way that it controls itself in an optimum level or at optimal values or figures. Now, if your glucose or your blood sugar goes beyond the normal, we have a hormone called insulin. Insulin is produced by the B cells of the pancreas, your pancreas, in such a way that it now reduces the high glucose or the high blood sugar level, bringing them back to normal. Then we also have a hormone called glucagon. Now, when your blood or your sugar levels goes down, it is the role of this glucagon to actually raise it back to the normal position, to the more normal value. So we find that our body is created in a very wonderful way, in such a way that when the things go up or when they go down beyond the normal, there are actually mechanisms that are employed into the state to make it come back to normal, and that is part of physiology, homeostasis. Now, I'll go back to my agenda, and I'll start with the types of diabetes. I know you only know diabetes as ugonjwa wa sukari and that's all, but I'll define to you more than there are about 6 to 7 types of diabetes that I want us to look about. Number one, we look at the type 1 diabetes. Type 1 diabetes is a brief explanation and or description about it. It is an autoimmune. Autoimmune, it means that your body is fighting itself, or your cells are fighting itself by the means of some immunological responses. And actually we find that about 5 to 10% of individuals with diabetes, they have type 1 diabetes. But something funny again about this diabetes is that it tends to show up, or people who are highly affected are the children and the young adults. And we find that when you have type 1 diabetes, it means that your body cannot produce insulin, or the insulin is very much insufficient to actually perform the work that is supposed to do in a normal person, and that means that you will need daily insulin doses for you to survive. That is so sad. Number two type of the diabetes, or kind of diabetes I want to look about, is a type 2 diabetes. Type 2 diabetes, in a simple explanation or description, is just resistance of the glucose insulin that is produced by the B cells of your pancreas. Now, when this resistance arises, then it means that the same insulin that is supposed to help you lower these sugar levels is not doing its work. It is not doing its work because your body has resisted it. Then it means that you need to actually be on the drugs, or to be on insulin injection, to actually boost the amount, or to boost the level of insulin that is produced inside your body. Now we find that this one is the most prevalent type of diabetes, attacking at least 50% or 50 to 70% of people who are living with diabetes. Now we find that also, if 50% of your pancreas B cells are affected, you are very much high likely to develop type 2 diabetes, and that's why it's very much common to people, and that's why it very much evident to people supposedly are around or above the age of 45 years. Then we also look at the gestational diabetes. This is a type of diabetes that attacks the expectant women who are pregnant. From the word gestation, gestational period defined as the period between the time of conception to the time of delivery. So at this point, a woman may develop diabetes, but the funny thing, or the good thing, that it goes away when the woman gives birth. And but that does not mean that it does not have a risk. It also have a risk factor, because it can also contribute to type 2 diabetes, or can be one of the factors that will lead further to type 2 diabetes. And the fourth one is pre-diabetes. Pre means before, so before diabetes. And actually what this means is that your sugar levels are high, but they're not high to that extent that they can be classified under type 2 diabetes. It means that your readings are not that high, but are above the normal ranges for a non-diabetic person. If a non-diabetic person, normal ranges should be 5.5. Then you are still reading at 7, or they start fluctuating 7, 8, or 8 to 8.5. Then it means that you are pre-diabetic, and that means that you are in the road of actually now getting the real, or I can say the type 2 diabetes. We also have other forms of diabetes that are 3 in number. They are not very common, but they are actually so significant for us to talk about. And one is drug-induced diabetes. Now, when you use this drug in classes of glucocorticoids and thiazide, you for let me say, for a longer period of time, or when you misuse it, probably in a prolonged use, you are actually likely to develop diabetes. Because of it, their own pharmacological, pharmacokinetic, and pharmacodynamic mechanism of action, mechanism of metabolism. Then it means that they will lead to the glucose level in your blood to rise, and that will risk you, or will put you in a susceptibility of getting diabetes. Then we also have diabetes associated with genetic syndrome. If any of your parent or your relative, a close one, or your grandfather, your grandmother had this type of diabetes with a genetic condition, then it means that you are also likely to get. And diabetes associated with syndrome include this Cushing syndrome and Down syndrome. So actually, when you have those syndromes, those genetic issues, then it means that you are at risk of getting also the diabetes. Then lastly, we look at the pancreatic diseases or pathological issues. Now, pancreas is the organ that produces insulin. It means that when your pancreas is sick, if your pancreas is sick or is having some malfunction, it means that you're risking yourself from getting the diabetes. And we're looking at the condition like pancreatitis. It means that there's inflammation of your pancreas. Your pancreas has swollen because of infection, because of it can be infection because of toxins, or because of trauma, or anything, or injury, something of the sort. And we're also just looking at cystic fibrosis, and also looking at hemochromatosis. Now, these are the things that affect your pancreas, and once they affect your pancreas, then it means that your pancreas will develop some issues in its function, and is actually likely to lead you to have diabetes. And I'm going to talk about the risk population as my point number 2. Now, the risk population simply means that the people who are at risk of developing diabetes in their life. And here I have several categories of people, and I'll start with the people above the age of 45 years. So when you have your age about 45 years and above, it can start at 40 or at late 60. It means that you are at a high chances of getting diabetes. We also have, if you have family history, any of your family member has developed diabetes in his or her lifetime, that means that you are also likely or susceptible to also get this diabetes, because diabetes can be genetic. Then the people, especially women, this is a women issue, who have polycystic ovary syndrome, you're also likely to have diabetes. If you are pregnant and you're diagnosed with diabetes, there's the another time that you get pregnant, you can also have the diabetes, and I'm talking of gestational diabetes. We also have people with high blood pressure, hypertension. If your blood pressure is above 140/80 millimol per Hg, then millimeters Hg, then it means that you're also at risk of getting diabetes. And we also have people with high density lipoprotein, or the glyceride level reading above 250 milligrams per deciliter. It means that you also have you are at risk of getting diabetes. And if you have impaired glucose tolerance, it means that your body cannot tolerate glucose to a certain level, perhaps level beyond or level below even the normal one, then it means that you're also likely to have the diabetes. And then we look at the signs and symptoms of diabetes. Now, the signs and symptoms of diabetes, they include the following. Number 1 is thirst. You feel thirst, you need to eat, you need to drink water, you need to take water every time and then. So that's one of the sign and symptom. We also have, if you're losing weight just anyhow, you don't know what is happening inside your body, you don't have any stress, but you're just losing weight, you need to consider yourself. And we also have dry skin. We have blurred vision. If you start seeing and clearly you have a blurred vision, then you need to visit the hospital for a diabetes test too. Then if you are feeling numbness, it means that you have an issues with your nerves. It means if you have issues with your nerves in any of your limbs or your arms or any part of the body, you are not feeling anything, then it means that you have a nerve issue, and that is can be part of diabetes. And when your soles, or when you have a wound and it takes time to heal, and it takes time to heal, especially your feet, then it means that you need also to be diagnosed or to be tested of diabetes. Then we shall look at the complication. Complication to mean what happens or what will happen when you don't treat or when you don't manage the diabetes. Before we reach the complication, after you have known the signs and the symptoms, you walk in the hospital. What happens is that you conducted some tests. Now, the tests that you are conducted, or the tests that you will be tested, they have they are varied. There are very many, and one I will talk about random blood sugar. Random blood sugar is an abbreviation or an acronym for RBS. Now, RBS is taken or retested any time of the day, and just to it is non-specific. So, if you walk in a hospital and you are tested diabetes without any other condition or without any other requirement or rules governing it, that one can be classified under random blood sugar. Now, for you to conduct, we also have apart from random blood sugar test, we also have fasting blood sugar. It is called FBS, fasting blood sugar. This is a test that is taken when you have not eaten for at least 8 hours. So within that 8 hours you're not supposed to eat anything. Then your sugars will be tested. So when they are tested after you have fasted or you have stayed 8 hours without eating something, then that one is called fasting blood sugar test. We also have some other types of blood sugar tests that are not very much common but are significant. One, we have HbA1c. HbA1c is conducted to have an average of your sugar levels in the last 3 months. Then we also have oral glucose tolerance test, abbreviated as OGTT. OGTT is a laboratory test for diabetes, to test your tolerance, your glucose tolerance in the body, to test your glucose tolerance in the body. And this one can be done in 2 hours postgrandial, and in the period of 2 hours they test your sugars. In the period of 2 hours they test your sugars until the time that the healthcare giver or the physician or the doctor seems best to have now the final readings of your test. Now, how do you do the random blood sugar? How do you conduct the random blood sugar? One, we have very many machines that do this blood test for sugar, and whatever I have here as mine is a glucometer. This is a glucometer. Glucometer is a blood glucose monitoring machine. Glucometer, blood glucose monitoring machine. I have here my glucometer. My glucometer has tested a number of people. I have conducted a number of people, have tested their sugar level, and I will power it on. I've powered it on. You can see the readings as I've powered it on. 12 hours or 24 hours. Now, apart from this glucometer, we have the strips. These are the sugar strips. Now, strips are coded. This is an example of a strip, a sugar strip that is used to measure the diabetes. One day I'll talk about the principle behind it. Now, when I have my glucometer, I've powered it on. I have my glucometer, I've powered it on. It is on. These are the readings from my glucometer. I recorded somewhere for someone is 17.7. Actually, for a normal person who is non-diabetic, the reading should not go beyond 6. If you are diabetic, your reading should not go beyond 7.5 or to the upper limits of 8. But this is a person who is diabetic, is a non-diabetic, and is taking the glucose levels are 17. This means it is high. This one is 10.9. This is high, considering the person was or has never been diagnosed of diabetes. This one is 5.2. 5.2 is normal. We have 8.5. 8.5 for an diabetic person, this is high. Therefore, he or she can be pre-diabetic or needs to be done with the diabetes. And then we're also taking into consideration how many hours or time has passed before this person ate and to the time of testing. You find that within 2 hours after you've eaten and you go to conduct this test, your levels will be high, but after 2 hours they tend to go down. So we're considering FBS and RBS. The readings are very much different, and they put one in at a different consideration. This one is 7.1. 7.1 for an RBS. This one for a diabetic person. This one is considered within the normal ranges. This one is 15.9 for an RBS. This one is high. This one is 7.6 for a diabetic person in a random blood sugar. This one is normal. Then we have 9.3. This is a bit high. We have 19.5. 19.5. This one is too high. Therefore, this person, I recommended him to have a management in diabetes, because at 19.5 this is too high. It means that you have hyperglycemia. After we have looked at the tests, because I outlined somewhere that diabetes and high blood pressure at some point they go hand in hand, and therefore you need also, apart from the diabetes, you also need this. This is a HTA, a blood pressure machine or blood pressure monitoring machine. So you need this hand in hand. You need a glucometer, and you need this blood pressure machine hand in hand for your diabetes. Suppose you have, because when you have HTN you are likely to have diabetes. Then I'll talk about the complication. Complication means what happens when you don't treat diabetes. What will happen when you don't treat diabetes, or when you don't manage it? Number one, you'll have issues with your eye. You will have eye problem. Retinopathy. Retinopathy, that means that the nerves that occur, or the part, especially the retina part of your eye, gets damaged and start giving you blurred vision. And actually, when you start feeling some blurred vision, it means that you need a sub to do to monitor your diabetes. We also have foot problems. Foot problems, especially when you get an injury or a wound, it takes time to heal, or you may actually develop some sores and they take time to heal. We also have heart attack and stroke. We have kidney problem. Now, the kidney and eyes are the first organs in the body to get the repercussion or the consequences or the bad thing about the diabetes when it attacks you. Then we also have nerve damage, and so nerve damage, remember in signs and symptoms I talked about numbness, kufaganzi. It means that your nerves have actually got some issues that need to be corrected, and when your nerves are damaged, it means that they cannot coordinate motion or movements within your body. Then you start feeling numb. They can't even actually control the muscles inside your body, and that means that you cannot move, or certain part of your body cannot move. Then this one we have an acute. Is an acute because when it attacks you, it is usually very fast, and it can kill you within a specific time frame when it's not managed, and that's none other than diabetic ketoacidosis. So diabetic ketoacidosis is an acute complication of diabetes, and that's why you really need to keep control of your blood sugar measures. You need to be monitoring them every now and then. Then as I conclude up, I would like to talk about the management. How do you manage diabetes? If you have diabetes, how do you manage yourself? And how for you to manage yourself, we look at the physio, like doing exercises, running, jumping, walking, jogging. Those are the things that actually help you fight diabetes. Then we also look at you reduce weight. go to the gym, do exercises, reduce weight, have a dietary plan, reduce your weight. When you reduce your weight, actually when you are obese, you are likely to have diabetes, and therefore when you reduce or you manage your weight, it means that you are at a good position. Then I also look at the quit smoking and alcohol. Quit. Yeah, when you have diabetes, you are immunocompromised. If you're immunocompromised and you're still continuing to smoke and take alcohol, you can actually suffer from this acute complication called diabetic ketoacidosis. Then I also look at the you monitor you monitor you monitor your glucose, and after you monitor your glucose, use drugs. You see, use drugs. So when the doctor has prescribed you the drugs to take for diabetes, don't quit. Take the drugs. If he or she has prescribed you insulin, metformin, glucophage, glibenclamide, and any other type of diabetic drug that you are supposed to take, please follow the doctor's instruction, and do not skip or miss the dosage. It will actually help you to manage your diabetes. So thank you guys for listening to me. My name is Isaac Ogutu. I'm the founder of Afya Fitness 20 Healthcare, and this is to sensitize people to have a clear overview of what diabetes is. And if you have anybody in your family who has diabetes and needs services from Afya Fitness, link him or her with us. We can have a conversation to help. We help people. We help diabetic, we help HTN, we help any kind of illness that is affecting our people in such a way that we want them to feel good, to feel better, to feel healthy. So thank you so much for listening to me. Follow our social media pages, that is Facebook, LinkedIn, Twitter, Instagram, and even YouTube at Afya Fitness 20, and follow our website, that is www.afyafitness20.com. Have a blessed evening. God bless you. Keep your health fit. Afya Fitness 20 Healthcare cares for you. Thank you.